Good morning. My name is Ashley Mazo, and I will be presenting the screening of acute traumatic stress disorder and post-traumatic stress disorder in pediatric trauma patients, a pilot study. This research project occurred at Atrium Health in Charlotte, North Carolina. I have no financial disclosures. Unintentional injury is the leading cause of morbidity and mortality in children in the United States. These children are at an increased risk of developing persistent stress symptoms that can impair their development and daily function. Acute traumatic stress disorder is defined as symptoms that occur between 3 days and 1 month after the traumatic event. Persistent symptoms, or symptoms that develop after 1 month, are defined as post-traumatic stress disorder. Current literature estimates the incidence between 6 and 45%. Early identification of these kids can lead to earlier referrals to resources. There is currently no validated screening tool to identify pediatric ASD. The primary objective of our study was to compare 3 screening tools used to identify ASD in pediatric trauma patients to the Child Report of Post-Traumatic Symptoms Questionnaire used to identify PTSD. The secondary outcome was to determine the incidence of ASD and PTSD in our study population. Once patients were identified, they were randomized to complete one of 3 ASD screening tools. Patients were contacted at 30, 60, and 90 days via telephone to complete the PTSD screening tool. Test characteristics were calculated using 2x2 tables. In our pilot study, from January 1st to December 31st, 2019, we had 263 patients that were admitted between the ages of 7 and 17 years. There were 49 patients that were excluded based on the exclusion criteria listed below. Of note, 143 patients were missed for various reasons. We had 52 patients that were randomized to take one of the 3 ASD screening tools. However, only 29 patients could be contacted via telephone to complete the PTSD screening tool. The mean age of our patient population was 13.3 years. There were 62% males and 48% African American. The most common mechanism of injury was MVC, or motor vehicle collision. Of the 3 screening tools, the ASC6 performed the best with a 100% sensitivity and 100% negative predictive value. The incidence of ASD in our study population was 41%. The incidence of PTSD was 31%. Limitations included the use of a PTS screening tool as the gold standard to calculate the test characteristics instead of the formal diagnosis. We also had poor enrollment due to the fact that we lacked 24/7 enrollment capabilities. We also had a hard time contacting families via telephone. We were unable to confirm if patients were formally diagnosed with ASD and PTSD. In conclusion, the ASC6 was the best screening tool of the 3. The incidence of ASD and PTSD in our study population was similar to the incidence reported in the literature. In next steps, we are going to train more individuals to enroll patients and administer the questionnaires. We are hoping to also expand to younger populations. Here are my references, and please contact me with any questions. Thank you so much.